it's absolutely marvellous. You're treated like a human being instead of a poor old worn-out thing in a chair.
When we go out, I love to go to Morrison's, but I'd rather go to a strip show.
There's someone to talk to.
Yes.
And you know that there's somebody there that cares.
And you've got something to look forward to as well.
Yeah.
Put a date in my diary and I look forward to that date.
I do believe the project really can change lives, and the evidence is there in Newquay to prove that. Some of the stories and the anecdotes I think are so powerful. I mean, saving money here and there and everywhere and what the bean counters think, but actually when you're talking at individual, personal level, some of the way that people who had been formerly housebound are now out in social groups, coffee mornings, it is wonderful. It's a lot of the sort of softer things, the softer elements that healthcare and social care have lost because of lack of resources and lack of time. Actually, by working with Age UK and engaging with the voluntary sector, it gives us an opportunity to actually put that quality of life back into people, and it really does work.
When you go into somebody's home, they're more at ease and you can break that barrier to help them and to re-engage them and to bring a little bit of laughter into their life and, you know, put a smile on somebody's face.
One of these clients didn't get out very much at all. She said something to me one day. She said, "You bring the outside in," which is, for her, it meant I was having a window on the world and I was bringing that back for her in our discussions and chats.
She says to me, "I love you coming to see me." She said, and she says it puts a smile on my face. You know, I'm a friend. I'm not a district nurse. I'm not a carer. I'm a friend to her.
What you're doing here is immensely inspiring, actually. I've been so impressed listening to great leaders locally talking about how they're changing services and the impact that it's already having in the areas where they've done this. So I think my job is to try and change the system to encourage this sort of wonderful experimentation and development of a new way of doing things rather than the centre always blocking things.
Myself as a GP and my colleagues in general practice are really enthusiastic and really looking forward to embracing that changing culture that changing lives will bring, as we've seen work so successfully already in Newquay, and we'll make sure it does work in Penwith. And also hearing those individual tales of how people's lives have been transformed, because when you hear the tales in the long run, it is heartwarming.